On April 1st, 2020, this channel released a video, Do Politicians Understand COVID-19 Statistics Well Enough to Make Decisions on Lockdown? The video asked, when can we ease the current rules on lockdown? When can we return to normal life? Much of what has happened over the past 4 months was anticipated in that video. However, there are two aspects that were very much underestimated. Just how much our freedom would be threatened, and just how much naked fear would be generated in the general public, who are constantly being told by the media, public health professionals and governments that the dangers posed by the COVID-19 virus are truly extraordinary and lethal. England is a good example of this fear, where citizens from 24 July 2020 are required to wear masks in all shops and supermarkets, even though there was no such requirement throughout lockdown. But no country better illustrates this fear than Thailand. It has a population of 69 million, and its economy relies heavily on tourism. Tourism has ground to a halt since the kingdom stopped allowing in foreign visitors. Many people are now starving and rely on food handouts. Millions of workers have applied for unemployment benefit. A prominent businessman estimates that Thailand's economic losses from the lockdown amounts to 16 billion baht per day, or almost 500 billion per month. That's about 15 billion US dollars per month. But despite these hardships, a recent poll says that 95% of those polled want to keep foreigners out to prevent a second COVID-19 wave. Such is the fear that has been generated. You might think, therefore, that Thailand has suffered enormously from COVID-19. Yet, in fact, out of a population of 69 million, only 58 people have died. To put this into greater perspective, a recent Twitter post highlighted that 58 people in Thailand had recently died in 1 day alone in road accidents. This seems to be a classic case of the cure being worse than the disease when the economic and social damage are considered. And for this reason, across the world, citizens are asking questions of their governments. In accordance with these concerns, this video has been produced to answer the fundamental question: is the fear of COVID-19 virus supported by the known facts? For although there may be the best of motives, it is this fear that drives governments when restricting our freedom. We put COVID-19 deaths into perspective using the data as of July 24, 2020, the You Must Wear a Mask Day in England. We start by asking, what is the total of COVID-19 deaths across the world since January 22, 2020, and compare that to a typical total of deaths across the world over the same period. January 22 is selected as the start point, as this is the date used by Worldometer's site. As of July 24, 2020, at 4:12 GMT, there have been just over 636,000 COVID-19 deaths. Our World in Data provides the information for typical deaths. Since 22 January 2020, which is 184 days, there have been over 28 million deaths throughout the world. We can compare that with COVID-19 deaths throughout the world. We see that COVID-19 deaths represent approximately just 2.26% of the total world deaths. The number of people who have died from the virus, therefore, amounts to just 0.008% of the population. Putting it another way, the percentage of the worldwide population that has not died of COVID-19 over the past 184 days is 99.992%. These percentages can now be used to make a comparison with other pandemics. Given that COVID-19 has resulted in the death of 0.008% of the world population, how does that compare with other pandemics? We have, of course, to bear in mind that the present pandemic is yet to complete. But as you will see, the comparison will be fruitful. This is by no means a comprehensive list of pandemics, but it provides a revealing basis for comparison. We will highlight these 5 examples. As you can see, the COVID-19 deaths are well below that of the Black Death and Spanish flu. There is no comparison. The number of deaths is also significantly below that of Asia flu, Russian flu, and Hong Kong flu. But as the COVID-19 pandemic continues, the numbers will increase. But if we take into account population growth, then an enormous disparity is revealed. The varying world populations are now added to the chart. We can see quite clearly that COVID-19 considerably lags behind all these pandemics. It is believed that the Black Death wiped out about 1/3 of the world population, reducing it from 450 million to around 300 million. The Spanish flu accounted for 2.7% of the population. The Asian flu, Russian flu, and Hong Kong flu pandemics all have significantly higher deaths per population. To bring out that point more clearly, for the present COVID-19 pandemic to equal the death percentage of the Hong Kong flu, which is the most recent and least deadly pandemic, a total of around 1.9 million deaths would be required. This is about 3 times the present figure. For the present COVID-19 pandemic to equal the death percentage of the Asian flu, a total of around 2.9 million deaths would be required. Those comparisons suggest that COVID-19 is a relatively mild pandemic. Therefore, it is worth comparing it with the annual deaths recorded for influenza. In 2017, the World Health Organization estimated up to 650,000 deaths linked to flu each year. With the consideration that the COVID-19 pandemic has yet to complete, we can say that deaths so far recorded are on a par with an influenza season, but will probably exceed that. We move on to compare COVID-19 deaths with other causes of death over the past 184 days. Our World in Data subdivides world deaths for 2017 into these broad categories. These are the typical figures caused by major diseases over the past 184 days. The COVID-19 virus has been the cause of death of more people than HIV/AIDS, but it is insignificant when compared to cardiovascular and cancer deaths. It is well below the annual normal deaths caused by respiratory diseases. And it is on a par with diabetes. We have been focusing on deaths so far, but there is also a concern that COVID-19 may be highly infectious. To address that concern, we can compare COVID-19 infections with a severe influenza season. The season of 2009 to 2010 had recorded cases of between 43 to 89 million. The present number of recorded cases of COVID-19 is between a sixth and a third of that. So is the fear of COVID-19 virus supported by the known facts? To help you make your own decision, we can summarize. COVID-19 deaths represent approximately 2.26% of the total world deaths. The number of people who have died from the virus amounts to 0.008% of the world population. The death rate per population due to COVID-19 is considerably less than previous pandemics. It is less than a third than that of the Hong Kong flu. COVID-19 deaths are on a par with a typical influenza season. COVID-19 deaths are significantly less than the annual major causes of death. The number of COVID-19 infections is between a sixth and a third of a severe flu epidemic. And one last thing. While 636,000 people have died from COVID-19 since January 22, nearly 2.8 million children under the age of 5 have died over the same period.